from the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. Gallstones are more common than you think. They affect about 10 to 15% of the U.S. population, and about a quarter of the nearly million people diagnosed with gallstones each year will need to be treated at some point, usually with surgery, and we want to avoid that. So, are there ways to prevent gallstones? We've got Baptist Health's Dr. Devin Ballard here from Sherwood Family Medical Center with some answers. Let's talk quickly, Dr. Ballard, this morning. What are gallstones?
So the gallbladder is under the liver. It's like a reservoir for your bile. And so the liver makes bile, it goes down a tube, it breaks food down. And so it holds the bile, and so whenever you eat, it kind of squeezes like a turkey baster. Squeezes out, more bile comes out, the food can be digested.
Okay.
That's where the gallbladder is. Gallstones are in the gallbladder. And they can be very symptomatic and problematic if people are having symptoms or they don't know they're having symptoms. So they can cause pretty severe illness. Actually, if it's if a stone gets out of the gallbladder and gets stuck in your bile duct, that's a problem because that's where the pancreas also dumps in its juices. And if it blocks it, you can gallstone pancreatitis is a severe a problem that needs to usually have emergent surgery. We try to prevent that by if you have symptomatic gallstones, aka I have classic, textbook is I went and I had something to eat, a dinner, and 30 minutes later have right upper quadrant abdominal pain, bloated feeling, sometimes associated with back pain because it's a pain referral. Even though there's nothing wrong with your back can hurt. It goes away after 30 to 45 minutes. Good to go. But if it happens repetitively, that means the gallbladder's pumping, the stone's getting stuck, causes pain. Then the stone falls back into the sac. However, if it pumps enough and that stone gets out of the gallbladder, the tube that empties is small. And if that stone, it's not like a marble, it could be a pencil, it could be jagged, like a rock. If it gets stuck, you can get very sick. Okay, so how can we prevent this from happening? What are some preventative measures we could take? So you see gallstones are more common in people that are obese. Eating a higher fiber diet helps. Not having rapid weight loss, like rapid weight loss can be associated with that. Like crash diets and stuff like that. Crash diets, and also I see a lot of gallstones after pregnancy. And that's kind of not uncommon, but I've had somebody last week, she was 22 years old, had gallstones, and she had just delivered a few weeks before, but she was symptomatic and had to have surgery removed. It's one of those organs you don't need. And so if we don't need it, we take it out if there's a problem. Another thing that people can have, it's called acalculous cholecystitis, where the gallbladder doesn't pump right. So the gallbladder should pump a certain ejection fraction of 35%. If it gets to like 15%, that bile turns to mud and it causes pain, and usually you have to get that removed. That's another reason to get the gallbladder out also. Okay, well, if you are experiencing some of those symptoms, it's not just post-meal bloating. Sometimes you need to talk to your doctor about it. So like Dr. Ballard said, if you're experiencing that right upper abdominal pain after eating, then it goes away. If it happens more frequently, please contact your primary care physician and just get checked out to make sure you don't suffer any of the severe symptoms of gallbladder or gallstones. Hey, thank you so much, Dr. Ballard. As always, we appreciate you stopping by. Contact Baptist Health at the information on your screen.